My name is Michael, and together with my team, this is my project on the systemic right ventricle, risks and outcomes of congestive heart failure. Now, before we get into it, I just want to establish a baseline of what the heart or how the heart works. In short, the right side of the heart is pumping to the lungs, whereas the left side of the heart is pumping to the body, and that pump to the body is known as the systemic circulation. So systemic right ventricle then is referring to a heart anatomy where that morphologic right ventricle is pumping to the body. And that happens in the context of this project as transposition of the great arteries. And there are two kinds that we look at. There's dextrotransposition with atrial switch operation, and there's levotransposition, also known as congenitally corrected transposition. Now, systemic right ventricle is problematic because at its essence, the right ventricle was never designed to sustain the high pressure system that is the systemic circulation. Without fail, these patients will deteriorate and will decline to the point of heart failure and death. And what's very problematic is that the standard heart failure therapies that we use for patients with regular hearts do not work well in patients with systemic right ventricles. The existing research on this field is incredibly limited because it's so rare. And that's where this project comes into play. So this is a multi-centered retrospective cohort study looking at the magnitude and risks, or looking to characterize the magnitude and risks of patients with systemic right ventricles. And so in doing that, we looked at all of the clinical markers that we have on these patients and their clinical and hospital visits. What I want to highlight though is the Saskatchewan data. So in Saskatchewan, we had 7 patients that met the inclusion criteria. And again, because this is quite a rare condition. But I want to focus on these 2 graphs here. The first one is looking at the systolic function of the systemic right ventricle, and it's comparing the initial visit versus the most recent visit at their cardiologist. And what you see is, over time, these patients have decreasing systolic function, and that's in spite of the interventions and the other medications that these patients are on. Their right ventricle will deteriorate. Similarly, if you look at the tricuspid valve, or the valve that's separating the systemic atrium and the systemic right ventricle, you're seeing a similar finding where over time, invariably, these patients have worsening valve function. All this is to summarize that the patients with systemic right ventricles inevitably will deteriorate, will develop heart failure, and will have poor health outcomes. But that's where this project comes into play. So, and thanks to the funding of the American Association of Respiratory Care and the American Heart Association, we're building an international database that's going to look at all of those clinical markers, all of the patient demographics, all of the variables that could be implicated in their clinical deterioration. And the hope then is that we'll be able to develop the very first of its kind clinical guidelines on how to manage patients with a systemic right ventricle. Thanks.